So just going to do a quick demonstration of what a targeted abdominal assessment is going to do. So I'm just going to act as the paramedic. I have a volunteer to act like the patient. Walk into the scene, introduce myself. I say, hi, I'm Matthew, I'm paramedic. What's your name? Nice to meet you, James. So James, what's going on today?
I just have a little bit of lower belly pain.
Okay, and you can verbalize, and it's not necessary, but I can see he doesn't have any obvious respiratory distress. He's breathing fine, and we can just feel his pulse, and I feel a nice, regular, strong pulse. I'll get my partner. My partner's just going to get a set of vital signs for you. So abdominal pain. So when did this all start?
Just like an hour ago.
Okay, 1 hour. And did it come on suddenly, or all of a sudden, like kind of like somebody like a light switch, or did it gradually come on slowly?
Yeah.
Okay, how long did it? When did you start? So it's been around for an hour. And when did you first notice anything that was different about your abdomen? Was it an hour ago, or was it before?
It was about an hour ago.
About an hour ago.
Something was there.
Okay.
And then progressively got worse.
And progressively got worse. What number? Could you give it a number initially? And if 10 was the worst pain you ever had, and 0 being none.
Initially, probably like a 2.
Like a 2 out of 10. And what is it as far as pain now?
About an 8.
About an 8. Okay. And what were you doing when it started?
Just resting, watching TV.
Okay. And do you think do you associate anything being the cause this? Nothing new today?
No, I've never had it before.
And you don't think that you're not aware of anything that's causing this, or anything that you've had before in the past that might be that you've previously been diagnosed with? So your symptoms, is it sharp or dull?
Like a burning.
Like a burning. Okay, where is it?
It's kind of all across the lower.
All across the lower, right across the lower, burning. And you never had anything like this before?
No.
And does anything make it better or worse?
When I take a deep breath, it gets a bit worse.
When you take a deep breath. What about if you cough?
No, I didn't know.
Doesn't notice any difference with cough changing it whatsoever? And anything make it better? Can't, like position of comfort, laying down doesn't make it worse, sitting up?
It's all...
Moving around doesn't seem to make it worse?
Maybe
Or
a little bit.
maybe a little bit?
Moving around, yeah.
Just not sure.
Yeah,
Okay.
it's hard to tell. It's kind of constantly there.
Yeah, but it's just across the bottom. And does it go anywhere else? I know it's right across the bottom. Is it localized to one side more than the other, or is it just all the way across and you can't really tell?
Maybe a little bit more on the right.
Does it and does it go anywhere else now? Going across your bottom? Is it going into your back, into your
Maybe
upper
the
shoulder blades, into
right
your
side
chest?
of my like upper right area.
Into the right. Okay, so it's kind of radiating up a bit, or
up
towards your shoulder
to
blade, or
yeah.
Okay. And do you have any other symptoms with it? Are you nauseated?
Yeah,
or
I threw up once.
You threw up
Yeah.
once. Okay. So if I'm understanding correctly, pain started about an hour ago, started off at 2 out of 10, then is now, you said, an 8 out of 10, is that correct?
Correct.
Okay. It's burning, and it's across your abdomen, it's radiating up into your back, but it kind of localizes a little bit more to the right.
Yes.
Okay, do you have any allergies?
Not that I'm aware of.
On any medications?
Nope.
No? Okay, so then you're drug compliant. And no recent discontinued medications that you normally take?
I was on just an SSRI.
Okay.
Fluoxetine, but they stopped that.
They stop that, and that's under doctor's recommendation to stop that?
Yes.
Okay. Okay, and with a lower abdominal pain, I'll walk through. He's complaining of lower abdominal pain. I may or may not, depending on where the pain is, walk through cardiac assessment, but we'll say with it going up into the right side, then I'm curious about that. So, do you have any diagnosed heart problems?
No.
No, okay. Never had any heart attacks, arrhythmias, slow or fast heart rates?
Nope.
No problems with the valves of your heart?
Nope.
Not having any chest pain or shortness of breath?
Nope.
Kind of weakness, disproportionate walking upstairs?
Nope.
Feeling weak, anything like that? And are you a smoker?
I'm not.
Not a smoker. High blood pressure?
Yes.
High blood pressure? Not medicated for that?
No.
Okay.
It's investigating.
Okay. Are you diabetic?
Nope.
And he's not obese. How old are you?
61.
61, so older. Family history of cardiac disease?
My father had heart failure.
Okay. But you don't have any.
Nope.
No respiratory diagnosed conditions, and you're not feeling short breath, no coughs, you're not coughing anything.
Nope.
Okay, we'll get to your abdomen there. No problem, no diagnosed problems with your stomach or your gastrointestinal
On and off
tract?
constipation.
On and off constipation.
Nothing diagnosed.
Okay, and when was your last bowel movement?
Yesterday.
And was that constipated?
No.
No, normal form stool at that time, not diarrhea or just normal
Nope.
form?
Normal.
And normal color. Okay, so no diagnosed problems with your stomach or esophagus, no problems with your liver, gallbladder, or pancreas.
Nope.
And you're just the constipation, no diagnosed with like diverticulosis or irritable bowel syndrome, anything like that, no diagnosed conditions with that. You haven't had any indigestion, just the nausea and vomited. Haven't noticed any changes in your appetite?
Nope. I eat a lot.
Okay. And no regurgitation, not kind of belching things up and causing indigestion. No excessive gas, belching no more, and bowel movements are normal. Didn't notice any blood in your bowel. We've mentioned that, but sometimes it can look kind of dark and tarry. You haven't seen that?
Nope.
No. And you don't take any over-the-counter medications regularly, like NSAIDs or
I do
anything like
take
that?
occasional Tums.
Take Tums?
That's only after big meals.
Okay, and did you try that today?
No.
And how much alcohol do you drink in a week?
Just social.
Just social. And any traveling to developing countries in the last 6 months?
Nope.
Perfect. We can pause.
No, you're fine, you're good.
Thank you.
Yeah. It's unpaused, you're good.
Okay. So no problems with your kidneys?
Nope.
Or bladder? Urinating normal, no pain with urination, no change in color,
Nope.
no change in smells of urine. Females will ask about menstruation and risk factors. So you never had previous UTIs,
Not that I know.
no hypertension, diabetes. I guess you're investigating hypertension. No heart disease, smoking, obesity, family history of kidney disease or infections. And not pregnant, so not obstetrical. I'm not going to ask obstetrical questions. Last time, so any other diagnosed conditions that you think you need to be aware of?
No.
And no other symptoms that you don't think we've covered?
No. I do have a back injury from work, but it's managed with just physio.
Just physio, don't take any medications for that?
Nope.
When's the last time you saw your doctor?
Oh, a couple months
Okay,
ago.
and no ongoing medical testing or?
Nope.
And
Just
your last appointment with them was just a checkup?
Just a checkup, yeah, for my back, yeah.
Okay. When's the last time you ate anything?
Probably this morning breakfast.
And how have you been the last week? Totally normal up till today, or was anything abnormal?
No, I felt pretty good.
Okay.
Felt pretty good.
I'm just going to do a physical assessment on you, if that's okay. We're just going to look at your eyes here. I'm just going to pull down your eyelid there and just look and see if we have any evidence of any anemia. Looks nice and big. Can you open up your mouth, stick out your tongue? Okay, nice and moist mucous membranes. I don't see any ulceration or anything like that. I get you turn your head just to the side. I just want to see. Now he's sitting up approximately 45. I see I don't see his jugular veins distended at all, so that's normal. You can look ahead. So that's inspection of his head. We'll come down to his chest. No pain in your chest at all. So I'd inspect and see respirations, quality of respirations looks normal. Don't see any barrel chest. No scars, rashes, and lesions over kind of his torso as I'm looking for inspection. I'm just going to have a quick listen to your lungs. Can you take a nice deep breath for me? And out. In and out through your mouth. And obviously I would not be listening through a sweater. Deep breath. Okay. Another deep breath. And out. And in. And out. And in. And out. And in. And out. Perfect. I'm just going to listen to one spot here in your heart. You can just breathe normal. Okay. He's got. I don't expect anything to be different here. Just with his pain up on the right side, we'd be concerned about is this pneumonia referred down? We'll just quick. He doesn't have a history of any cough or productive cough, so it's unlikely. So that's inspection, palpation, percussion, and auscultation. I'm just going to look at your abdomen, if that's okay. When we're assessing abdomens, we'll always lay somebody down. So if I just want to lay down, if they were in a position that I couldn't lay them down, then I just get them to push on, often just get them to push on their own belly and say, is it's tender there? And when we get to the structure, then we lay them down and actually look for softer deep palpation. But we'll say that we're in a setting that we can pull through. Is it okay if I expose your abdomen? So we'll expose that abdomen, and we're going to first look at the shape and have eyes to look. I'll try to just demonstrate and not teach. But, so just looking, he's got some small pulsation, which is normal for somebody who has a slight build over kind of midline over his aorta. It's not excessive by any means. I don't see any distension. I don't see any visible peristalsis, and I don't see any scars, rashes, or lesions. So as far as inspection, abdomen looks normal shape. And then we'll auscultate for his bowel sounds before we push around and cause any kind of fake bowel sounds. So you can just breathe normal. I'm just listening to your bowels. And typically we'll listen for 10 to 15 seconds per quadrant. If you're doing this really thoroughly, we'd want to be more like a minute per quadrant, maybe even 2 minutes to rule out absent bowel sounds. But right now I'm just trying to get, are we hypoactive or hyperactive? That's all we're getting, and I'm getting listening to what squeaks and gurgles we have. And we have normal bowel sounds at this point, not grossly hyperactive or not hypoactive, but I am hearing some squeaks and gurgles there. I'm just going to push on your abdomen. I'll start away from the pain. So I'm just going to palpate. Does this hurt over here? Okay. What about here? And when you're palpating, just I tend to, if you just flex at your, I don't know, first joint, that tends to give you, and make small circles. You tend to feel more. So anything hurt there? A little bit. So I notice he's guarding a little bit. He'll just try to relax there for me as best he can. Does that hurt over there when I push in? And what about over here? A little. Top is worse up here. Okay. So that's as far as light palpation. As far as deep palpation, depending on what he'll tolerate. Like deep palpation is to feel if I have any enlarged organs. So I'll palpate over, and I can palpate up. He's not tolerating that. And what about down on this side? Hurt down in here?
Just a little.
Okay. So I'll just palpate up and see, can I feel an enlarged liver? He's guarding quite a bit right now, so I can't really feel deeply. He's not guarding on this side as much, so I can't feel any enlarged spleen on that side. So we found there. Now, as far as rebound tenderness, we can just see, so he's already done some demonstration of, does he have peritonitis? So when he coughs, if he jiggles his guts by coughing, if the peritoneum is inflamed, then it causes pain when he does that. So can you cough for me? And does that hurt anywhere? No. What about when you raise your head up? Does that make any difference to your pain? No. Okay. And just percussion at first, rebound tenderness. I'll go to the side that doesn't have pain, push in fairly aggressively, and then let go quickly, because we're just trying to bounce. The cough is a good assessment of peritoneal inflammation, but also rebound tenderness. And on this side, does that hurt at all? What about down here? Does that hurt if I push right on that spot?
No.
Thinking about McBurney's point when I let go quick. And it up in here is where you're finding more. Can I get you to exhale? I'm just going to I'm just going to hook my fingers under your rib cage a little bit. Exhale there. No, inhale. Now, if he has an irritated gallbladder, he'll not like me hooking my fingers. And does that cause you significant amount of pain? Okay, so we've done inspection, palpation, auscultation, and percussion. I'm just going to percuss on his abdomen. See, it sounds nice and hollow. If he was distended and I thought that he might have ascites, I'd percuss over until I find a spot that's dull, and it will fall over until it feels dull. Then I'll get him to roll onto his side, so come on over onto his side. And if he has free fluid, that fluid, I just found the water line, and if that free fluid, when he lays on his side, it'll pull down to that side. So if this was dull and now becomes resonant, then he has free fluid or ascites in his belly. So there's other means, but that's probably the easiest way to tell. So we'll just continue down with no incontinence. Down through the extremities, no scars, rashes, or lesions. Looked for any pedal edema down in his feet, and good color. You feel and move everything fine. Down his arms, any scars, rashes, and lesions. His nail beds look good. Palms of hands, no big palmar erythema, no scars, rashes, or lesions. Okay, now we're gonna sit him up. So we're gonna gather ourselves. We've kind of done a level conscious OPQRST, ample physical assessment. We'll get our vital signs back from our partner. Now we'll talk about a differential diagnosis and then work towards a differential diagnosis. We can stop there.
Nice.